Yeah, good morning, student. Today we are going to discuss about the lecture number 25. The topic is thyroid disorders, the disorder related to the thyroid glands. You know that thyroid gland is present in the neck regions below the larynx, which produce hormones like thyroxine, T3 and T4. So this thyroid disorder are common problems that can cause the symptoms because of over or under production of thyroid gland. Means there be the more production of thyroid hormones, that is over, or less production, that is under function of thyroid gland. Thyroid gland produce thyroid hormones which maintain the body metabolism. So the main function of thyroid gland is to maintain the body metabolism. Thyroid disorders are, it may be hyperthyroidism, hypothyroidism, and goiter. So, what is hyperthyroidism? Another name of hyperthyroidism is also known as thyrotoxicosis. Hyperthyroidism, also called as thyrotoxicosis, is a hypermetabolic and biochemical state caused by excess production of thyroid hormones. When there is excess production of thyroid hormones, then there will be more metabolism and there will be more biochemical process taking place. That's why it is called as hypermetabolic and biochemical state. The condition is more frequent in females and is associated with the rise in T3 and T4 levels in the blood. T3, that is called triiodothyronine, and T4 is called tetraiodothyronine. T4 is also called as thyroxine. If you see the etiology behind this hyperthyroidism, then main is caused by some common disease. That first is known as Gravis disease. That is also called as diffuse toxic goiter. So what is Gravis disease? It is actually an autoimmune disorder that causes hyperthyroidism or overactive thyroids. Your immune system, what happens? It attacks the thyroid gland and cause it to make more thyroid hormones than your body is required. So this is called as Gravis disease. Then you have a toxic nodular multinodular goiter. Um, it is a condition where it contains multiple autonomous functioning nodules which causes excess production of thyroid hormones which do not require the stimulation of thyroid stimulating hormones. So that is called as toxic multinodular goiter. Then toxic adenoma. Toxic adenoma is also known as tumor of glandular tissues. So these are the main three etiologies, that is Gravis disease, toxic multinodular goiter, and toxic adenoma, which leads to more production of thyroids and cause hyperthyroidism. Less frequent causes are like hypersecretion of pituitary TSH. So if pituitary gland is releasing more thyroid stimulating hormone, then it also causes the more production of thyroid glands. Because of pituitary tumors, because of the pituitary tumors, it is releasing more thyroid stimulating hormone, and because of hypersecretion of thyrotropin releasing hormones. So, and what is TRH and TSH? TSH is the hormone which is released by the pituitary gland, and this is the thyrotropin releasing hormone is released by the hypothalamus. Then this thyrotropin releasing hormones acts on pituitary glands, and pituitary gland then release TSH. Then this TSH will act on thyroid glands, and finally the thyroid hormones is released. So this is the process. Then another reason is thyroiditis, that is the inflammation of thyroid glands. So there are three main common reason for hyperthyroidism, and this is the less frequent found reason. Then we have types of hyperthyroidism. The first is primary hyperthyroidism, second is called secondary hyperthyroidism. What is primary hyperthyroidism? It is due to the excessive production of thyroxine by thyroid gland, as in the case of Gravis disease, toxic multinodular goiters. So because of this, it leads to thyroidism, that is called as primary hyperthyroidism, whereas secondary hyperthyroidism is because of some exogenous administration of thyroid hormone. If there is hormone is being injected from outside, or because of the thyroiditis, that is the inflammation of thyroid gland. So there are two types of hyperthyroidism. Primary hyperthyroidism is because of the Gravis disease and toxic multinodular goiter, and secondary hyperthyroidism because of the exogenous administration of thyroid hormone and thyroiditis. What is the etiology of hyperthyroidism? The first is toxic diffuse goiter. Toxic diffuse goiter is also called as Gravis disease. Then toxic adenoma. Toxic adenoma is a condition when a single nodule or lump grows on the thyroid gland, causing it to become enlarged and produce excess thyroid hormone. So that is called as toxic adenoma. And toxic multinodular goiters is again so having more nodules and lump. Thyroiditis, again the inflammation of thyroid gland. Then iodine induced hyperthyroidism. Even if we have more iodine, then also it leads to hyperthyroidism, because iodine is the primary requirement for the synthesis of thyroid glands. So more the iodine, more the hormones will be synthesized. Then excessive, if the pituitary gland is releasing excess of thyroid stimulating hormone, so that it stimulates thyroid to produce more thyroid hormone. Then excess injection of thyroid hormones. If you take a injection of thyroid hormone, then also it causes more thyroid hormones, leads to hyperthyroidism. Then what are the symptoms of hyperthyroidism? Some most common is nervousness, irritability, palpitation. What is palpitation? It is nothing but irregular heartbeat, and tachycardia, that is increased heart rate. Then heat intolerance or increased sweating. What is heat intolerance? Heat intolerance is the feeling of being overheated when the temperature around is more, that is called heat intolerance. Then tremor, weight loss, alteration in appetite, then frequent bowel movements or diarrhea dependent lower extremity edema. Means there is more diarrhea, then it leads to more edema. Then sudden paralysis. Then exertional intolerance. What is exertional intolerance? People are not able to do their usual activities and may be confined to bed. So that is called as exertional intolerance. And dyspnea, that is, that it is difficult in breathing. Then menstrual disturbance, then impaired fertility, mental disturbance, and sleep disturbance. So these are some common symptoms of hyperthyroidism. Then pathophysiology of hyperthyroidism, where we mainly going to discuss this flow chart. So hyperthyroidism, also called as thyrotoxicosis, is a stage that results from any cause of the increased amount of thyroid hormone. So anything which leads to more production of thyroid hormones, that can be the reason for the hyperthyroidism. The common disease that cause primary hyperthyroidism include Gravis disease. We know this Gravis disease. Then toxic multinodular goiter, then toxic adenoma, then follicular thyroid carcinoma. What is follicular thyroid carcinoma? It is a cancer of thyroid gland. Then the flow chart in the pathogenesis of hyperthyroidism, we are going to start with hyperthyroidism is characterized by loss of normal regulatory control of thyroid hormone secretion. So if the control over the thyroid hormone secretion is going to lost, then it is going to cause the hyperthyroidism. Then the action of thyroid hormone on the body is stimulatory. It stimulates many function, and also called hypermetabolism. That is more the thyroid hormone, more the metabolism, and it is going to stimulate many of the body functions. In that one of the they are going to stimulate or increase the sympathetic nervous system activity. So once the sympathetic nervous system activity is going to increase, it is caused the alteration of secretion and metabolism of hypothalamic, pituitary and gonadal hormones, because we know that above the pituitary gland there is a thalamus, which is a part of nervous system. Nervous system is consist of especially autonomic nervous system is consist of sympathetic and parasympathetic. So if this sympathetic nervous system is going to increase, then it causes alteration of secretion and metabolism of hypothalamic, pituitary and gonadal hormones. Then excessive amount of thyroid hormone stimulate the cardiac system, because more the thyroid hormone, more the sympathetic nervous system, and sympathetic nervous system supply to the heart is going to stimulate, and which leads to increased heartbeat, that is tachycardia, increased cardiac output, then stroke volume also increase, then adrenergic responsiveness and peripheral blood flow, these are also going to increase, which finally leads to a negative nitrogenous balance, lipid depletion, and the resultant state of nutritional deficiency. Nitrogen balance is nothing but it is a measure of the net change in the total body protein, or we can also say that it is the nitrogen intake minus nitrogenous loss, that is nitrogenous balance. Then finally it is going to cause hyperthyroidism. So this is the pathogenesis we are going to write for hyperthyroidism. So in hyperthyroidism, actually I was studying about thyroid disorders. So it is mainly hyperthyroidism, hypothyroidism and goiter. So hyperthyroidism we discussed, we see the etiology, we see the types, then some more etiology, then symptoms of hyperthyroidism, then pathogenesis, where we are going to draw this flow charts. Now the another problem related with the thyroid gland is Gravis disease, because most of the places we have seen the Gravis disease. But what actually this Gravis disease is, that for that the explanation is Gravis disease is found more commonly in women. Genetic factors and autoimmunity cause Gravis disease. So it is because of mainly autoimmunity, your own immune system is going to cause this Gravis disease, and it results from the type 2 hypersensitivity reaction. So in this type 2 hypersensitivity reaction, autoantibodies are produced against thyroid stimulating hormone receptor, and this autoantibody is called thyroid stimulating immunoglobulins. In short form it is called as TSIS. So this is the name of the autoantibodies, that is T for thyroid stimulating immunoglobulins. The immunoglobulins is another name of antibodies, also called as thyroid stimulating antibodies, or it is also called as thyroid receptor antibodies. So we know that our immune system is having two important cells, B cell and T cell. And B cells, when it get activates, it produce plasma cells, and this plasma cell will produce antibodies, and these antibodies immobilize antigen. Then immune system produced autoantibody called thyroid stimulating immunoglobulin, and it is going to attack the thyroid cell. And this thyroid stimulating immunoglobulins, it mimics means produce a similar action, uh, mimic the action of thyroid stimulating hormone. So there will be a competition between this immunoglobulin and this thyroid stimulating hormones, and finally thyroid stimulating immunoglobulin going to bind to this thyroid stimulating hormone receptors, and because of the binding of this immunoglobulins, which is produced because of the autoimmunity, and this thyroid gland is stimulated to produce excess amount of thyroid hormones. Actually, this is the receptor, thyroid hormone receptor, where thyroid stimulating hormone has to be binded, but this antibody is binding, and it keeps on stimulating thyroid glands to produce more thyroid hormones. So this leads to a condition called as Gravis disease. So it is because of the type 2 hypersensitivity reactions. Means your own immune system is producing or identifying your thyroid hormone receptors as a foreign substance, as producing antibodies against that, and it is going to bind and keep stimulating the thyroid gland to produce more amount of thyroid hormones, which leads to Gravis disease. And we know that Gravis disease leads to hyperthyroidism. Now the second disorder is hypothyroidism, and it is the state where the thyroid gland stop producing a sufficient concentration of thyroid hormone, that is T3 and T4 hormones. In hyperthyroidism there is more production of thyroid hormones, whereas in hypothyroidism there is less or no production of this thyroid hormone. What is the etiology of hypothyroidism? The first is autoimmune disease. Autoimmune disease means your immune system attacks your own thyroid gland by producing autoantibodies. That is leads to hypothyroidism. Then the treatment of hyperthyroidism, sometimes we use radioactive iodine or anti-thyroid medications, which can result in the permanent hypothyroidism. Then in some thyroid surgery, removing all or a large portion of thyroid gland can diminish the hormone production. Then in radiation therapy, which used in the cancer of treatment of cancer of the head and neck, can also affect the thyroid gland and may lead to hypothyroidism. Then as some medications like lithium is used in some psychiatric disorders, which can also leads to hypothyroidism. So these are the some etiology like autoimmune disease, then treatment of hypothyroidism, thyroid surgery, radiation therapy, and certain medication. This can cause less production of thyroid hormone. Symptoms means there will be more cholesterol levels, there will be depression, fatigue, hair loss, memory loss, dry, rough skin, and constipation. Then pathophysiology. In primary hyperthyroidism, the loss of functional thyroid tissues leads to a decreased production of thyroid hormone, and main causes includes autoimmune thyroiditis, loss of thyroid tissues after surgical or radioactive treatment for hyperthyroidism, head and neck, radiation therapy, medication, and endemic iodine deficiency. Even there is less iodine, then less hormones will be synthesized. Secondary hypothyroidism is caused by the pituitary's failure to synthesize adequate amount of thyroid stimulating hormone or lack of thyrotropin releasing hormone. Tertiary hypothyroidism includes traumatic brain injury and subarachnoidal hemorrhage or pituitary infractions. Hypothalamic dysfunctions result in the low level of thyrotropin releasing hormone, thyroid stimulating hormone, and finally thyroid hormone. So this again we can explain in this small flow chart, where this is the normal regulation and this is the hypothyroidism. In normal regulation, it starts from hypothalamus. Hypothalamus, if it is not, it got dysfunction, then it leads to tertiary hypothyroidism, and which causes decreased thyrotropin releasing hormone, because we know that this is the thyrotropin releasing hormone released by the hypothalamus. Then this hypothalamus release thyrotropin releasing hormone, which acts on anterior pituitary, and this anterior pituitary is going to release thyrotropin stimulating hormone. That is, and if there is a pituitary dysfunction, then this pituitary dysfunction leads to secondary hypothyroidism. This anterior pituitary then release thyroid stimulating hormone. Then this acts on thyroid gland, and thyroid gland produce thyroxine, that is T4. But if there is any problem at this thyroid gland, that is destruction or inflammation, that leads to primary hypothyroidism, which is the main type, which constitutes around 90 to 95% cases. So hypothyroidism is mainly tertiary, secondary, and primary. If there is any dysfunction at hypothalamus level, then it is called as tertiary. If there is any dysfunction at pituitary level, it is called as secondary, and if there is any dysfunction at thyroid gland, then it is called as primary, which is the main type, which constitutes 90 to 95% cases. Then another problem related with thyroid is goiter, and we know that it is the enlargement of thyroid gland. Excessive stimulation of thyroid gland by TSH can result in goiter. So there is a thyroid hormone, thyroid stimulating hormones, which keeps on stimulating the thyroid glands to release thyroid hormones. But if there is no iodine and there is no synthesis of thyroid hormone, so this keeps necessarily keep on stimulating thyroid glands, but thyroid hormones is not being formed. Then this leads to goiter. Types, first is colloidal goiters, endemic, develops from the lack of iodine, and then second is non-toxic sporadic, caused by the medications like lithium. Then toxic nodular or multinodular goiter. This type of goiter forms one or more small nodules as it enlarges. An etiology of goiter is insufficient iodine in the diet. Drugs such as lithium, then pregnancy. Being pregnant can sometimes cause thyroid to become larger. Then Gravis disease occurs when thyroid produces more thyroid hormones than the normal, is known as hyperthyroidism. Then inflammation of thyroid cause goiter. Symptoms: enlargement of thyroid gland in the throat, difficult swallowing or breathing, coughing, hoarseness of voice, dizziness. Symptoms of hyperthyroidism, and it starts showing the symptoms of hyperthyroidism as well as hypothyroidism. Then for pathogenesis, we are going to draw this flow chart, which starts from iodine lack. If there is a lack of iodine, which is the main reason of goiter, and goitrogens. What is goitrogen? It is a substance that decrease the production of thyroid hormone by interfering with iodine uptake in the thyroid gland. So these are the substance that is going to disrupt the production of thyroid hormones. How? By they interfere with the iodine uptake. They stop the iodine uptake in the thyroid gland, because we know that in the thyroid gland iodine has to come, then only the process of thyroid hormone synthesis take place. Then this too leads to deficient thyroid hormone production, and there is excessive thyroid stimulating hormone stimulation, which causes cyclic hyperplasia. And we know that what is hyperplasia? Increase in the number of cell of thyroid glands because of the excessive stimulation. Involution means shrinkage or return of an organ to a former size, that is the involution. It leads to diffuse goiter. What is the meaning of diffuse? It means it is spread out over a large area. That's why the size of the thyroid glands keeps on increasing, which again cause repeated hyperplasia, means the number of thyroid cells keeps on increasing in the number. So repeated hyperplasia, involution, which leads to the fibrosis of involuted areas, the formation of more fibers, and this leads to the growth of hyperplasia area, which finally leads to goiter. So this is a topic that is called as thyroid hormone disorders, where we have to mainly understand what is hyperthyroidism, hypothyroidism, and goiter. So hyperthyroidism is there is more production of thyroid hormones. Hypothyroidism, less production of thyroid hormone, and goiter means increase in the size of the thyroid glands. So these three you have to explain in little detail. Thank you.